If you, a loved one or a friend, is suffering with sinus congestion, sinus pain, stuffiness, it's horrible. I know what it feels like myself. And we get these problems from the common cold, the flu, allergies, pollen, dander, smoke, perfume, or even certain foods that we react to. This causes a histamine reaction in our nasal area. It starts to swell, it congests, and it affects behind the nose, which are the eustachian tubes. And behind the eustachian tubes is the middle ear, connecting from behind the nose all the way to that middle ear area. And when those eustachian tubes get congested, it can cause not only sinus problems, but tinnitus, ringing, pain in the ears, vertigo, dizziness. It's something that you don't want to have. But I'd like you to know about the paranasal sinuses. It's a group of 4 paired air spaces that surround the nasal cavity. The maxillary sinuses are located under the eyes. The frontal sinuses are above the eyes. The ethmoidal sinuses are between the eyes. And the sphenoidal sinuses are behind the eyes. And those sinuses all flow together. But the most common sinus problems that we see are maxillary sinus problems underneath the eyes and the cheekbones and the frontal sinus, all up above the eyebrows. And most of those sinus medications to reduce that congestion, that stuffiness, to get you to sleep, or whatever it may be, all of those have side effects. And what makes this technique so special is that I accidentally came across it myself through my patients, which I'm about to show you. But when we stimulate this particular point in the wrist, this area will cause afferent bombardment. It will make its way back up to the brain. The brain goes through its chemical changes to the neurotransmitters. And through these neurological, neurochemical events, the brain then sends messages back to the sinus area, as it will vasoconstrict the vessels as your congestion starts to drain. So here's what we need to do. You can use either a hand. Right at the crease where the hand meets the wrist, there's a line there. You're going to take 3 fingers of the other hand and apply the top finger right at the crease. At the bottom finger right here, right below it in the center of the forearm, that's going to be our point. So we're going to take our thumb of this hand and we're going to apply it right at the bottom part of that last finger. You should be between 2 tendons, right in the middle. It should be hollow. And when you apply pressure in there, you'll start to possibly even feel relaxed right away, because this is a master point. This is a point for nausea, a great point for digestion, but this is what's going to help your sinus. I need you to apply deep pressure in there. While applying deep pressure, we're going to traction the fascia and the muscle in the wrist, everything above where we're holding. So apply deep pressure and extend your hand backwards. Go ahead. Keep extending it backwards till it can't go anymore. It should feel nice and tight as you traction it out. Now just hold it there. And while holding it there, you're going to start to feel some changes behind your nasal area. It's quite fascinating. But the neurological changes will definitely start to happen. If you need to hold it a little longer, I'm going to tell you about 30, 40 seconds. You can hold it up to a minute. But just hold that point as your brain is going to work. As you feel those changes, you can release it, push it back again, and stimulate it as you go back again like this. You can do that about every 15, 20 seconds. You'll let it go after that, come back, put that pressure in there, and go straight back again. And just hold it back there. And you'll start to see those changes. You can't imagine what it's like until you feel it. And you can do either hand, and if one hand is not as effective, do the other hand. For the majority of you, I promise you're going to feel changes. Now, what's exciting about this technique is that once you stimulate this area for a minute, 2 minutes, or even 3 minutes, if you have to, you're going to start to feel changes up to 15, 20 minutes after. So I hope this technique serves you well. Remember, it's safe and it's very effective, and do it as often as necessary. Please share this video with your friends and family. Leave your comments below And most important, make it a great day. I'm Dr. Alan Mandell.